6 News. My name's Sarah, and if you're wondering, that's S-A-R-A with no H, because H's are L.
And I'm really black. Here are tonight's headlines. Switching over to Edmonton, Alberta is Juicy J. Over to you, Juicy.
Thank you, Mr. Black. Today we have 3 guests on the line who are going to be speaking about security, universality, and accessibility of electronic health records in Alberta. I'm here on the phone with Professor Kim Stoppable.
Good evening, Juicy.
I have some questions for you regarding the universality of Alberta's healthcare system. Who is eligible for coverage in Alberta?
Well, under Alberta Healthcare Insurance, it includes all Alberta residents are eligible to receive publicly funded healthcare services under the Alberta Healthcare Insurance Plan. Residents refers to a person who is lawfully entitled to be or to remain in Canada who makes the province his or her home and is presented in Alberta. It excludes tourists, transient, or visitors to Alberta.
Oh, okay, thank you, Kim. And who is not eligible for coverage in Alberta?
People who are not eligible for coverage in Alberta are members of the Canadian Forces, members of the Royal Canadian Mounted Police who are appointed to a rank, and people serving a term in the federal penitentiary. All these residents receive coverage from the federal government as to why they are not eligible for coverage.
Interesting. And are people who have moved to Alberta from other countries covered under Alberta's healthcare system?
People who are from outside of Canada who move to Alberta are eligible if they are landed immigrants, returning landed immigrants, or returning Canadian citizens. Temporary residents arriving from outside Canada who may be deemed residents include person or visitor records, student, employment authorization, and minister's permits.
Okay, thank you for joining us, Kim. And now joining us, we have Dr. Pesto Seuss.
Good afternoon, Juicy. Okay, so before we begin, I would just like to define what security actually means. So in general, it is defined as the extent to which personal information can be stored and transmitted in such a manner that access of the information is limited to authorized parties.
Okay, first off, how does Alberta ensure the security of the patient's electronic health records?
That's a great question, Juicy. So Alberta has a number of security safeguards in place. The first one is secure access, which is a two-faced authentication process, meaning it needs an ID, a password, and an authentication device, which is somewhat like a USB, but it protects your information. Encryptions are used, which means that the information that is shared is encoded. Controls such as firewalls are also used, as well as intrusion detection systems. In Alberta, the logs are audited, which ensures the information is accessed properly, and if not, there is a follow-up. There are also penalties, which can go up to $100,000. That's a lot of money.
An electronic health record contains a lot of confidential information. Can you please explain the type of information that is secured?
Of course, there are things like your lab tests, your history, your discharge summaries, your immunizations, and your emergency department reports. Also, your medical history would be on there as well. One more thing before I go, Alberta has something called masking of the patient's record, which means all information is hidden except for their date of birth, last name, and first name, of course, their gender, and their health number. It can be removed if clinically necessary or by the patient.
Perfect. Thank you for joining us, Dr. Seuss. We now have our last guest online, Barbie Doll, who is a nurse in Alberta.
Good evening, Juicy.
Now, who has access to the health records in Alberta?
Many healthcare professionals have access to your electronic health records. These healthcare professionals include physicians, residents, nurses, allied healthcare professionals, administrative workers, and management. Also, you as a patient have the right to access your electronic health records. You can ask questions regarding the Alberta Netcare, or request for a copy of your health records, or request to see who has viewed or used them.
Speaking of access, are there any fees to access your own health record in Alberta?
Yes, there are some fees to access health records. These will be based on the amount of time needed to prepare the information, copying costs, computer time, wages for the health information workers, and shipping or delivery costs if necessary. In order for a patient to obtain their electronic health record, they must fill out a request form.
Thank you, Barb, and thank you to our other two guests for joining us tonight. Back to you guys in the studio.
Thank you, GCJ. We now turn it over to Albino in Ottawa, Ontario.
Thank you, Sarah. Joining us on the line is Morgan Freeman. Hello, Morgan.
Good evening, Albino.
Just Alice fine. Now, in your opinion, what exactly is universality?
Universality refers to the universal access of healthcare according to needs, regardless of ethnicity, gender, age, social status, or ability to pay.
Now, Morgan, which jurisdiction is in charge of universality of Medicare in Ontario?
The federal government ensures that provinces, including Ontario, meet certain requirements such as free universal access to publicly insured health.
Universal healthcare sounds interesting. Now, does this mean I can get any procedure done for free?
While universality holds that everyone is covered, it does not necessarily mean that everything is covered. Comprehensive coverage under the CHA extends only to those services that are medically necessary. In Ontario, medically necessary procedures are covered by OHIP, which has to be done in the hospital by physicians. Dental services are partially covered by OHIP, as well as eye examinations for people under the age of 20 and over the age of 65.
Now, luckily for us in Ontario, we do have universal healthcare. But what happens if I'm to visit, say, Alberta or something, and I fall ill? What happens then?
Ontario healthcare coverage benefits can be used across Canada. The province or territory you'll be visiting will usually bill directly to Canada. If in any chance you have to pay, you can submit your receipts to local ministry office to be considered for reimbursement.
That's really good to know. But what happens to me if I was to travel outside of Canada, say New York, for example, or even Jamaica or something? Yeah? Would I still be covered by healthcare?
As a matter of fact, emergency health services such as unexpected illnesses, diseases, or injuries are covered by Ontario if patients have travel insurance, but ambulance services are not covered by OHIP.
Now I'm back in the studio, and joining us via satellite is public health specialist Dixon Cox. Thank you for joining us, Dixon.
Thank you for having me, Al.
Now, Dixon, granted, the electronic health records are significantly advantageous to the Canadian public healthcare system, yeah? But given the confidentiality of the information on these records, how secure is the information on them?
Well, currently the most common methods of securing health information, electronic health information, is data encryption and the use of passwords. But in today's electronic age, passwords just really aren't cutting it.
You say they aren't cutting it. Could you expand on that a bit?
Well, actually, Al, there have been a few instances where personal health information was hacked and manipulated. I mean, yes, a password can deter the general majority, but for those who are able to enter the patient database, not only are they able to view the information, but they can copy and disclose this information to unauthorized personnel, usually for profit. Speaking of which, there was this one incident reported in the Washington Post about 2 years ago, I think. A hospital contractor at Howard University Hospital, they downloaded the patient files onto their laptop, and their laptop was stolen. So whoever managed to steal that laptop and actually get into the laptop would have had access to tons, thousands of patients' information.
Wow. So does that mean our information can be compromised from the inside then? Wow.
That's the sad truth, Al.
Okay. Touching on that incident then, are there any legislations directed towards the protection of our electronic health records from the inside then?
Well, depending on the type of information, two legislations come to mind. We have PHIPAA, which I'll expand on in a second, and PIPEDA. In Ontario, PHIPAA, that's the Personal Health Information Protection Act, must be adhered to, as opposed to PIPEDA, which there's a bit more wiggle room, right? You see, PHIPAA sets guidelines pertaining to the collection, use, and disclosure of personal health information. It factors in patient consent for the use and the disclosure of personal health information, accountability of the healthcare provider or as far as personal health information is concerned.
Well, thank you for joining us, Dixon. That was really insightful of you. Thank you.
Thank you for having me, Al.
And we're back here in the studio with Lucy Luhu. Good evening, Lucy.
Good evening, Al.
Now, Lucy, regarding the accessibility of electronic health records in Ontario, roughly how many physicians are actively using this?
Okay. So around only 5,000 out of the 20,000 physicians are using electronic health records.
Interesting. So what's one major reason why the number of physicians using this is so low?
A major reason is that less than 2,000 physicians have actually received the funds that were specifically allocated for this purpose.
Interesting. One final question for you, Lucy. How accessible is an electronic health record here in Ontario?
The overall accessibility is actually quite low. This is because a very small amount of physicians are using electronic health records. Also, another reason is that physicians are having a difficult time with electronic health record accessibility because they have not received the funds for the implementation and therefore do not even have the equipment that's needed.
Thank you for joining us tonight, Lucy.
Thank you, Al.
All right, and thank you to all our guests on the show tonight. And on behalf of Channel 6 News, stay breezy, my friends.